Yeah. Yeah, you can see.
Yes, I can see.
Okay, so I will open the 3 minutes.
Is there any more information?
No.
Okay, yeah, thank you. Hello, I'm Dr. Sanam from the, sorry.
Yeah, go ahead, go ahead. Go ahead.
Yeah, hello, I'm Dr. Sanam from the practice, one of the
Yeah.
GP. Am I speaking to Mr. Daniel Harris?
Oh yeah, I'm Daniel Harris.
Okay, and before proceeding, can I confirm your age?
Yeah, I'm 24.
Excellent. So, I understand that you shared the picture to the practice of your lower back, and it seemed like you're struggling with the pain and swelling. Is it correct?
Oh yeah, it's pain, doctor. Yeah, very, my lower back is very painful, to be honest, doctor.
Yeah.
I'm not sure what to
I'm
do.
really sorry. Yeah, I'm really
Mm.
sorry. Are you okay to talk now, or you
Yeah.
need some painkiller?
Oh no, no. I already took some paracetamol and they did help a little bit.
Mm-hmm, mm-hmm. Okay. Can you tell me from the start, how did it started and what did happen?
Well, to be honest, it has been lingering around, doctor, for a few months now. Um,
Mm-hmm,
sometimes it will, my lower back will become swollen a little bit, and then, the pain will increase, and then suddenly I'm finding something popping out, and I will find some
mm-hmm,
blood and some pus there.
mm-hmm. Okay. And you mentioned it's been few months with the pain and swelling. Does it
Yeah.
comes and goes, or it's there or
Oh
there?
yeah, it's recurrent. So it's like entering in cycles, doctor. So pain, swelling.
Mm-hmm,
The swelling will come, and then I think it will pop out, and
mm-hmm,
then you know, and and that's
mm-hmm,
never ending. I'm not sure what to do, to be honest.
mm-hmm. So when you see it comes and goes, or come out and then it goes, have you tried anything, or you contacted us before?
Oh no, to be honest, I was, you know, I'm a student and a medical student, doctor, and you know that we are studying a lot and there is no time. But I little bit, when I find it coming and going, I said, uh, I need to seek the help. I don't know what's happening to my back.
Mm-hmm. Yeah, yeah, that's very much right. You've done it. But did you had any thought in your mind that come across that what it could be?
Well, I'm not sure, doctor. I hope it's not a cancer. It's just this chronic recurrence is making me thinking about cancers. I'm not sure why.
Mm-hmm,
Probably, we have some family history of also squamous cell carcinoma, doctor. So, yeah.
mm-hmm, mm-hmm. Okay. When you say cancer, is it because of your family history of having squamous cancer? Can you tell me more about it? Like, who had cancer, or
Oh, it's my
why you
auntie.
think
My
about it?
auntie. Well, just
Mm-hmm,
we took, in the lectures, we took in the lecture, like chronicity of the disease can be a red flags of cancer. So I said,
mm-hmm,
that's
mm-hmm,
who
mm-hmm.
knows. Let me ask.
Mhm. I appreciate that coming forward, and I understand that you must be really good student taking interest in thing, and this must have come as a thought to you. But I will ask some question. We will go through together to see that
Sure.
is it something else? Is it cancer? Yeah.
Okay, sure.
Apart from cancer, did you had any other worries at all?
Well, the pain, doctor, when I'm sitting, to study, it's is a little bit annoying. And then, also, we will have soon the midterm exams, and there will be, we'll sit for 3, 4 hours for the, finishing the exams. So if I'm not
Mm-hmm,
comfortable, that will affect my performance in the exam.
mm-hmm, mm-hmm. Yeah, I appreciate that. I will try my best to help you. Yeah. Um, uh,
Sure.
Before proceeding, were you hoping something to achieve today?
I'm not sure though, just to reach the diagnosis, probably. I know that maybe the phone call is not ideal, or the video call not
Mm-hmm.
ideal, but I did send the picture through, System
Mm-hmm.
Connect. I'm not sure, did it reach you?
Yeah, yeah, I saw the pictures, and that's why I'm able to talk to you, and I'm able to speak to you.
Okay.
Yeah, I can
Fine.
see the picture. But making before making what it could be possible, is it all right if I can ask some questions?
Oh yeah, sure.
Um, yeah, are you having any fever?
Oh no, thankfully no fever.
Mm. I can see the picture. Is there any discharge coming out of it? Any pus at all?
Not currently, but yesterday, it popped out, and there was a lot of pus and blood.
Mm-hmm. Okay. And is there any, just one second. Yeah. So, apart from pus and the blood coming out, did you notice this swelling anywhere else?
Oh no, there is no swelling anywhere else. But where specifically, doctor?
Like on your armpit, on your groin at all?
No.
Okay. And by any chance, did you notice any change in your weight?
Oh, maybe I put on weight from the studying, doctor. I think I
Mhm.
increased like 10 kilos over the last 6 months.
Okay. And how do you perceive your weight? Like how much it is?
Well, I think now I'm overweight, doctor.
Yeah. Okay. So, and any pain at all? Like any lower back pain? You mentioned the pain
No,
around the
there is
swelling.
pain. Yeah, but this is in the lower back pain
Mm-hmm.
where I'm sitting.
Any any weakness at all?
No, no, no weakness.
Okay. Okay. Any numbness of your legs?
No.
Yeah. And how's your appetite?
Uh, but it's okay. You know, I like my food.
Hmm. Any problem with the bowels? Like any blood in your stool?
No, not I'm aware of.
Okay. Have you had any long-standing illness? I can't see anything in the notes.
No, 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 doctor. Well, maybe when I
Any
was a
med
child, I had some asthma, but no, I grow out of it probably.
hmm. And apart from paracetamol, any other medication you are using at all?
No,
Okay. Any allergies?
no, not I'm aware of.
Okay. And is it all right if I can ask you a question related with lifestyle? Sometimes these are related.
Mhm.
Yeah. Do you smoke cigarettes?
Oh, no, doctor.
Do you drink alcohol?
No.
That's really good. You mentioned that you are a medical student and it might affect in the future that you would be having a long sitting because of your exam coming up midterm. Just few questions. To whom do you live with?
I'm living in the university campus, doctor. In the student house.
Mm, okay. Okay. Um, yeah. Okay. Thank you so much for answering these questions. Um, it seemed like by looking at the picture, I need to first. Is it possible for you if you can come to the practice? I want to have a look as well.
Mm. What you
Yeah.
would like? Mm,
I want to examine it, but by looking at the picture, there are few thoughts in my mind. Um, it doesn't seem to be cancer to me by looking at the picture, but I want to see you face to face. Yeah. It can be that we say a condition we call pilonidal sinus.
mm-hmm.
Yeah. So, have you heard about it?
No.
Okay. So, it's something like what happened when there is a sometimes there is an opening in the skin, yeah, and it seemed bit red and it seemed inflamed. So I can think of it can be pilonidal abscess, as you mentioned that the pus and the blood is coming out. So when we say pilonidal sinus, it is a something that's a gap in the skin, yeah, and especially the between the two buttocks, yeah, on the down below. And when it's something, obviously you mentioned that you're sitting a long time and you gain weight because of increased weight and because of sitting long period of time. It's something it can cause this problem coming back again and again. Are
Mm-hmm.
you with me so far?
Yeah.
Yeah. And you mentioned that it's coming and going. You are eating and drinking well, perfectly okay. I want to examine you face to face. Just want to feel your tummy. Yeah. And I want to examine it. And as you mentioned, it comes and goes on its own. And you were worried about cancer. Just want to assure you that it's less likely to be cancer. But
But there is a
I will refer.
possibility, doctor, that it might be a cancer.
By looking at the picture, it's less likely, but that's the reason I want to see you face to face. More likely because of increased weight, having prolonged sitting. This is the most common reason which I think of in my mind. That could be the reason for that. Uh, there are a few options for that. One thing, having pus and discharge coming out, I would suggest that if we start the oral antibiotic, we say flucloxacillin, 500 milligram 4 times a day for 7 days. And it's something that, as it you mentioned, that it comes and goes. So it's better to have opinion from the specialist like surgeon. Sometime incision and drainage of the sinus prevent this from happening again.
Oh, so incision and drainage. Okay, when will be that, doctor? Because my exam, so is I'm not sure.
Yeah, what I'm going to do, I will send a referral to the local CSS team, like local community team, so that we can get the incision and drainage as soon as possible, so that prevent from back happening it again. But as it looked like there's a pus and blood, so at the moment I would start with antibiotic, 500 milligram flucloxacillin 4 times a day. And there are a few things we can do together, like if I would suggest, like if you reduce your weight by having increased physical activity, it's something that will help from happening it again. And also, if you try, as you said, like you're gonna sit for longer period of time, like 3 or 4 hours or more longer than that, I would suggest if you stand up and have short breaks, stand up tall, walk around for 2 3 minutes, and come back and sit back again for your studies. I understand study is really important for you, but it's something, having little bit of activity, it will refresh your mind, and also it will help with this. What do you think about it?
Oh yeah, doctor, no problem. No problem.
Yeah. And
Yeah.
I want to assure you that it's less likely to be cancer. And you mentioned your family member had a squamous cell cancer, but by looking at it, it doesn't seem to be squamous cell cancer.
Okay. But can
Yeah.
be, do we need to now to cut it down, doctor, or drain it? I mean, can it be by after my exams, doctor?
Uh, let's I would suggest, is it possible for you to come today to the practice?
Oh yeah.
Yeah. So once you come in there, I want to have a look, because it's something, we can give the antibiotic for now. And then depending on the examination, whether it's something we can postpone um, after your exam. Is it all right for you?
Oh yeah. But what is the drawback of this, doctor?
That's a really good question. That if it's, as I said, like giving the antibiotic may help from getting it more angry, but if it's something that if we don't treat it, like this infection can go to your muscles and it can go to your bone, and it may make you more unwell. So I would suggest it's better to get it, like specialist to review and start on antibiotic, and so that you will be in good position to more focus on your exam rather than worrying about that what it could be, or if it happen again, it will affect on your performance as well in your midterm.
Okay.
Yeah.
How the drainage will be, doctor? Just, it's very sensitive area, so I'm not sure.
Yeah. So, incision drainage, I can send you the leaflet information about what procedure is it, but I can tell you what this procedure is. So, it's something that first they clean the area, yeah, and numb the skin with a small needle around the
Mhm,
swelling, yeah,
mhm,
and
mhm,
give a small nick and drain the pus in there.
mhm.
It doesn't seem like it's not too big to cause a stitching, but it depends on if this area requires stitching or not.
Okay, sure.
Do you have any questions?
No, no.
Okay, thank you so much. And I will send you the leaflet information. But in meantime, if you notice that you're getting any fever, you're feeling really unwell, not eating and drinking, or you feel like you're feeling really unwell, you can contact us back, or you can call 111, and I will arrange an appointment to see you today. And once I get feedback from the specialist, I will book an appointment with myself again.
Oh yeah. So, doctor, what is the local community team? So that will be in the hospital or where?
I need to check on, CSS is the local community for minor procedures, yeah, in our area. But I will double check whether they are able to do the incision and drainage of this pilonidal abscess. If they are able to do it, otherwise we will send to the hospital, like general surgical team, to do the incision and drainage.
Sure.
Okay, thank you.
Oh, you want to upgrade the painkillers?
Oh yeah. So I would, as you said, like at the moment you're feeling better with the taking paracetamol, you're able to speak to me. But there are other options for the painkiller, like ibuprofen. You can get from the over the counter, or I can give you the prescription of 400 milligram ibuprofen. You can use 4 times a day. But there are some side effects. It can cause heartburn, and at any time you notice any blood in your poo, or if you notice any blood in your vomit, please contact us back. We have other painkiller options, yeah. But if you feel you're not getting better with paracetamol and ibuprofen, we can add on codeine.
Mhm. So which is better, doctor, the paracetamol or the ibuprofen?
That's a good question. I would suggest if you take paracetamol every 6 hourly, yeah, and 2 tablet of 500 milligram, 1 gram every 4 hourly. And then if you feel the pain is not getting better with that, you can take ibuprofen like 400 milligram up to 4 times a day. So
Mhm.
you take paracetamol regularly and ibuprofen whenever you have the pain which is unbearable, that you can take 4 times a day.
Sure, sure, doctor. Yeah.
Do you have any questions?
No,
Thank you.
you are welcome. Okay, how do you feel?
Mm, I think I took too long in data gathering. Um,
Probably
I think I
because you
took.
were surprised, maybe. Probably you were surprised by the photo problem, maybe. No,
Mm, yeah.
because what is the yeah? Well, so reaching the diagnosis is not the key, okay? But yeah, your diagnosis is right, okay? But the key here, how you reach the diagnosis, isn't it? So you have a
Mm,
skin opening and pus, coming every now and then from it. So is it pilonidal sinus or fistula from the anus or from the rectum? One will not give the same shape. Give the same, yeah.
fistula. He would have the bowel problem. You mentioned you don't have any
Yeah,
bowel
yeah,
problem.
yeah. Then
So
then you
then
need
I ruled out fistula. I should have said
then
like it can be
then you,
sebaceous cyst or
yeah,
yeah.
then you need to tell him why you are asking about bowel issues, isn't it? And the other thing,
Mm,
is if there is any stool coming out from it or not. Yeah,
mm,
that's important. And then sebaceous cyst that can present like that. And when the swelling is happen, how big is it? Is it boil? Maybe boil. How we will know? Maybe small boils. And that's also, so how big is the swelling? What type of pain you are getting? That
mm-hmm,
was an important, isn't it? You didn't ask about any pain around the anus itself, okay? Around the stool opening itself, okay? When he opened his bowel, there is any pain. That all is important because, differential, again, differential, what can be. That is skin opening. Yeah, most probably in that place is a pilonidal sinus. But then pilonidal sinus or boils or carbuncle for sure is larger and multiple cysts. Okay, or is it, rectal, rectal fistula and, making that opening, okay, or something in the bone itself, or did it spread to the bone itself, is the pain only in this area or spreading to the rest of the spine? That need to be asked. I like that you ask about the sciatica and, the probable neurological affection, okay, which can be in pilonidal sinus. Okay, I have one patient pilonidal sinus that he started to have fournier gangrene because of it. Spread the infection spread to the perineum, and then from the perineum it spread to the leg. Thankfully, it spread to the leg. Okay, and didn't spread to the intra-abdominal, which is very rare. Okay, that the patient will have the infection to be spread to the lower limb rather than spreading to the abdominal cavity and the deep pelvic tissue. And at the end, they need to remove half of his, muscles of the lower limb, to sacrifice the rest of the limb. Okay, so that's one of the complication, spreading of the infection locally. Okay, that's important to ask. Okay, is it now as the picture that you send? Is it there is any redness around, there any tenderness around, okay, to decide you will give antibiotic or no. There is an important, do you think that patient's childhood is important or no? To ask some
Mm.
specific questions. Do you think is important to know or no?
Mm, I think he was 24. He said I noticed few months ago, so I didn't ask about childhood, that whether he had this since childhood.
Yeah, I would
Uh,
ask about spina
Pilonidal.
bifida. I would ask about spina bifida because incomplete spina bifida with sinus, with pilonidal sinus, that's is a warning sign for me. Okay, because mean that the spine will, with if the sinus play up little bit. Okay, first they can that can be incomplete spina bifida and started to open up in the skin, for example. Okay, or the opposite, or if this is a pilonidal sinus and it started to to find its way in the subcutaneous tissue and reaching to the bone, this means that if the patient they have incomplete spina bifida or spina bifida, that infection will be directly in the spine. So that's what's important.
How to
How you
ask
are
about childhood
diagnosis?
from him?
Well, you ask him, he will know. Spina bifida. Do you have a tuft of hair at this area from before? Spina bifida usually. This is how even you can diagnose it in children. Yes, how you will diagnose it for sure. If you feel the spina, there is no defect in the bones. Okay. The other thing, the incomplete spina bifida. How you will know? Tuft of hair. There's tuft of hair. I mean, collection of hair just above the vertebrae where the problem is. That's an important. When you are doing the baby check, 6 to 8 week check, are you palpating the spine or no?
Mm-hmm.
It's important. You take the spine from up to down, from the cervical spine downward until the bottom. Okay, because you are checking what, searching for any bony deformity. That's important. Okay, and then you will turn him around and check his stability of the hip. Okay, so these things should be done in the 6 to 8 week check. It's good to ask. I mean, it's all good to ask. And as you said, yeah, for sure, any bowel changes, that's important to see if there is Crohn's or ulcerative colitis can be occur. And the systemic symptoms, and when there is recurrent infection, you will need to ask about
Diabetes.
diabetes. Yeah, don't forget about that. Yeah, this can be early signs of diabetes. That's important. Okay, so diabetes symptoms. Okay, family history of diabetes, and then he told you red flags of cancer. You know why? Because I had one patient who had, pilonidal sinus, and he ignored it. And then after a few months, they diagnosed him as having squamous cell carcinoma in the tract of the pilonidal sinus. So the tract itself started to form a cancer and malignancy. But unfortunately, that it was too late. Okay, so already the spine, the squamous cell carcinoma making metastasis to the liver and the spine. So that's important to ask, any night sweat, loss of weight unintentionally, okay, lumps and bumps and swelling, and be specified where the lumps and bumps, in the groin area, and then above the groin. Okay. And then what will be, yeah, you said for him, yeah, you can, if you said, prolonged sitting, increase in weight, what other self measure you would consider to tell him? Keep this area clean and, dry. Always cut the hair in this area. The hair should not be accumulated. Okay, there always need to, to trim the hair. Yeah, and then yeah, I will do an urgent referral to the local surgery team or this, to the hospital. Okay, because that need to be excised. The type, the type of surgery I will show you. Okay, I will show you the type of surgery. Okay. Uh, does it need antibiotic or not? Well, if no inflammation now, no active inflammation, redness, and then already is drained, probably you will not need the antibiotic. But if there is an abscess, okay, and there is no drainage point, then you would need for sure the antibiotic, okay. And if there is cellulitis around, you will need the antibiotic. And if there is systemic symptoms, But if it's only a hole and just draining the accumulated pus, you will not need always the antibiotic. Okay, so that's also a matter of negotiation with the patient. Okay, and I'm not against the flucloxacillin, and for sure if the patient have recurrent pilonidal sinus, you need to make swabs. Okay, swabs, and make sure that there is no TB, and because TB can also affect the spine and this area. So having a culture for the recurrence, you know, sinuses is very important. Okay. Um, is that clear for this case? Okay. Maybe the diagnosis, or maybe the explanation, because I didn't get it, to be honest. You said opening in the skin. So what is the cause of the opening?
I was also not sure how to explain.
Well, it's
I'm
just a
trying to
hair.
make it up.
No, yeah, yeah. No, don't make it up. Yeah, yeah, for sure. You
I
try
mean,
and
how to
take
say
any
it?
mark. Well, but
Is
it's
it
just
because of heat or friction?
is it because of what?
Heat or friction or
Oh,
infection.
friction. Yeah, yeah, yeah. That's true. So the tip of the hair the tip of the hair at this area is burred, okay, or turn it over and started to irritate the skin, okay, and then the skin will make an abscess at this area, okay. So is buried hair that cause irritation or continuous irritation of the skin, okay. So most probably you will need sooner or later to do an operation. Okay. Sometimes in acute stage, if you're inflamed and you give antibiotic, this part of hair will be will be expelled out of the skin. But most of the cases, no, you need to open it up. Okay, because the abscess will be full of hair actually inside. So it's not like one hair; it's full. A lot of hairs there. Okay, and then they need to be opened and scooped. Okay, most of the surgeon, they like it to be, as we said from before, to be healed with the secondary intention. He don't like to close this area because it's sweaty and a lot of bacteria inside, so they like to leave it by granulation tissue formation. Sometimes they will close it. Sometimes also plastic surgeon will do different things in this area. Okay, different techniques, but the most common technique is just to scope it, remove it, and let it heal by the secondary intention. And for that patient, tell him most probably, that to heal up, it's need at least 2 months. Okay, because I will show you that how the the incision look like. So nearly they are reaching towards the bones. Okay, so that's take a lot of time to heal. So he might need a modification of his um, of his um, the exam time. Okay, so the exam timing, he might need modification. So you need to give him a realistic expectation. Otherwise, he will not be happy. Okay, uh, is that clear up till now, doctors? Anything need to be repeated? Uh, no. So
You
if you
asked,
have
you asked a question about whether paracetamol is better or ibuprofen.
Oh yeah, so for pain management, for pain management, it will not make a difference except according to the pain ladders, yes. But this is an inflammation, isn't it? So the anti-inflammatory will be best in such cases, yeah, because there is inflammation. It's not only a pain. Okay, so you need an anti-inflammatory
Okay,
for
thank you.
this case, yeah. Uh, I just wanna close the recording, okay, and we will see or let me see show you the incision, how it look like, and then I will give you your specific feedback, Sana, because there is some issues I need to raise it with you. So we can see here sinus, and this is the abscess, and then it's a tuft of hair. So tuft of hair, okay, uh, the hair end will turn to the opposite. So that will turn to the inside. Okay, so it will bend and enter to the inside, and then growth of the skin above it, and then the cyst will be formed, or the abscess will form. So we can see the close proximity of that abscess with the the tailbone, okay, or the sacrum, the coccyx, and the rectum. So that can, can just easily move, go to the bone, cause osteomyelitis, go to the rectum, cause fistula, or the opposite can. So the fistula from the rectum can go here and cause the problem. Or if you have here in spina bifida, the spine is open, can easily, make a fistula to the skin. So that should be considered as a differential. Here they just open it and suture it. So they evacuate the abbas and the hair and the suture it. The problem, the high recurrence rate of such maneuver. Okay, these are the possible differential. Where's the other? There was a couple of other photos. I'm not sure where the scope is. So usually when we remove it, okay, and let it to heal by secondary intention, it's leaving a big, so a big gap. Okay, so if you look at here, this area here, so if so, can you imagine? Unfortunately, I'm not sure where is the picture, but I will show it to you later on. So this is all this area will be left without suturing. So and leave it just packing, and then he will go every twice weekly, and they will remove the pack and insert a shorter pack. So can you imagine how it will be? And that's nearly reaching to the bone. So yeah, it's not an easy operation, and it will take some times to be healed. It's one of the difficult operation, to be honest, for the patient, okay, to to cope with it. Okay, does that make sense? Okay, I will just to close the recording now, and then we'll discuss further, doctors.